system today. I will talk about the sympathetic and parasympathetic nervous system. In the next session, I will talk about the hypothalamus. And in the afternoon session, I will talk about the association cortex. And we will finish your nervous system today. Okay? Physiology. And on Saturday, you will have the exam, midterm exam. Actually, I'm here in the Kish, but I'm not here in the exam. So, you know that we have central nervous system, CNS, composed of brain and spinal cord, and we have also PNS, right, composed of spinal nerves and cranial nerves. Part of this system is somatic. So they receive information from the body, right, surface of the body, like skin, joints, muscles, and process the information and send the output to the muscles. So this is the somatic part of the nervous system. But some other information comes from the internal organs, like from the heart, vessels, intestine, stomach, all of this, right? So information comes to the CNS, integrated there, and then actually sent back to the internal organ. So sensory information from the internal organ is processed in the CNS, and then it is sent back to the same internal organ. So we will have regulation of the activity also in the internal organ. So this system is called autonomic nervous system. You are not aware of that. It happens subconsciously, okay, but it works actually. And its work is usually powerful and strong. Okay? So the autonomic nervous system, ANS, controls visceral functions of the body, like arterial blood pressure, gastrointestinal motility and secretion, bladder emptying, sweating, body temperature, and so on. Okay, so all of these are controlled by the ANS. And these activities are controlled, actually for most of these activities, the whole function is controlled by the ANS. But sometimes the internal organs can also be regulated by other things, like endocrine system, part of the somatic system. Okay? So, here you can see the general organization of the ANS system, right? Autonomic nervous system. It can function in two different ways. One way, which is simpler, is this one, visceral reflexes. So some of the internal organs are controlled by reflexes. So there should be a sensory stimulation inside the body that comes to the spinal cord or the brain. Then a motor response is generated. Motor response goes to the same organ or other. So this is very simple and reflexive control. So you know that a lot of examples, like the baroreceptor reflex. So an abrupt decrease in the blood pressure activates baroreceptors. Baroreceptors send action potential to the brainstem, usually medulla and pons, right? Medulla. Then some motor signals go to the sympathetic nervous system, and they come again to heart and blood vessels. They increase heart rate, heart contraction, they they constrict the vessels. So cardiac output increases, right? Resistance in the blood vessels also increases. The result is increased blood pressure back to the normal level. So the stimulation first was decreasing the blood pressure. Now the reflex increased the blood pressure. So this is reflex, right? So this happens in several organs, several internal organs. So we have reflexes in the GI system, for bladder emptying, for actually activation of the heart, anywhere in the body. Okay? Another way for controlling the autonomic nervous system is this one, the limbic cortex I will talk about this today, limbic cortex, okay? Part of the cortex. It actually coordinates activity in some centers in the spinal cord, brainstem, and hypothalamus. And they have some autonomic functions. So, autonomic functions can be from the brain toward the internal organs. Okay, so from the CNS, we have limbic cortex. Limbic cortex affects brainstem, spinal cord centers, and hypothalamus. They activate autonomic nervous system. Or that it can be reflexive from visceral to CNS, from CNS back to the visceral. So we have reflex, or let's say top-down control. From top down, right? So from the limbic cortex to the autonomic nervous system. So two different ways for activation of the autonomic nervous system. So let's compare somatic nervous system and autonomic nervous system in terms of innervation of the organs.
Sir, only spinal cord is responsible for reflexes, or the subcortical area is also responsible?
No, we have reflexes also in brainstem, in the limbic system, in the hypothalamus.
Sir, then what is the difference between these two?
So actually, for some internal organs, spinal cord itself is enough. Okay, for example, for GI system, some part of GI system, like for colon and small intestine. Okay, spinal cord can generate some reflexes. But for upper part of the GI system, like for chewing, okay, brainstem is important because cranial nerves actually innervate the muscles of the mastication. Okay, and also, for example, for eyes. So you know that the ciliary muscle here is a muscle that is not under your control. Okay, it's involuntary muscle. So it can, for example, change the level of light reaching the retina, or it can, for example, widen or narrow, actually comes to reach the pupil. Okay, so this is a reflex actually controlled by the brainstem in the midbrain. So reflexive movements in the eye is controlled by the brainstem, but reflexive control in the intestine is controlled by the spine. So we have different levels of regulation for internal organs. Right? So remember that we have alpha motor neurons in the ventral horn, which innervates skeletal muscle. We have neuromuscular junction here, which releases acetylcholine. Acetylcholine binds to nicotine receptors, activate the muscle contracts. Okay, you know this. But compare the somatic part with the autonomic part. Here you have two neurons, not one neuron. Okay? And there should be a synapse between these two neurons. This synapse happens in a structure called ganglion. So in the autonomic nervous system, motor part, okay, autonomic nervous system, we have ganglion. So there is a preganglionic neuron and a postganglionic neuron. The preganglionic neuron has its cell body in the CNS. So for example here, right? But the cell body of the postganglionic neuron is inside the ganglion. So the first distinction between the somatic part and the autonomic part is that in the somatic part you have only one neuron, but in the autonomic part you have two neurons. The other difference is that here you have some classic type of synapses. An axon terminal make contacts onto muscle fiber. So you have synapse too. But the type of the synapse in the autonomic nervous system is different. So you can see that the axon of the postganglionic neuron come here. It generates something which is called varicosity. Okay. Something like protrusion, like a bag. Okay? So inside this varicosity you have several vesicles. So neurotransmitters are inside the vesicle. And when action potential arrives here, vesicles release their content. And the neurotransmitter can affect several target cells. So here you have only one target cell in the synapse. But here you may have several targets. So neurotransmitter is released, it diffuses, and it can affect a lot of cells. But this is not the end of the synapse here. The axon continues, it generates the second varicosity. The second varicosity also do the same function like this. Then axon continues, and you will have another synapse. So the synapse is not ended here. Okay? Here you can see the sympathetic nervous system. So autonomic nervous system has two parts, sympathetic, parasympathetic. Right? So you know that sympathetic nervous system starts from the T1
L2
to L2. Very good. And the preganglionic neuron is in the intermediolateral horn of the spinal. Right? Intermediolateral. Then, preganglionic neurons leave the spinal cord through the motor roots. It enters some ganglia. We call them sympathetic chain or paravertebral chain. Right? So we have piled up some ganglia just near the spinal cord, but it's outside the vertebral column, right? Okay, so neuron come here, the preganglionic neuron, and actually it enters some of them enter the ganglia. Okay, so here is prefrontal ganglia or perivertebral ganglia. Okay, so you know that there are several of these ganglia: celiac, superior mesenteric, aortic-renal, inferior mesenteric, right? And then from the ganglia we have postganglionic neurons that go to the internal organs. Some of them go to the kidney, others go to the intestine, large and small, right? Some others go to the liver, stomach, pancreas, bronchi in the lungs, heart, eyes, right? Some others go to the colon, the ureter, bladder, uterus, genital area, okay? So
what is the black fiber and what are the red fibers?
yeah, the red one is preganglionic, the black one is postganglionic.
Sir, we have only sympathetic fiber from T1 to L2, but from C1 to T1 there are some preganglionic fibers.
Yeah, you can see it. Some of the preganglionic fibers enter the chain, but instead of having synapses here, they go upward in the chain. So they can, for example, activate some other chain, some other ganglia in the chain. Okay? So you can see them here. So the exact connection is shown here. So the vertebral column, right? You have the ventral roots of the spinal nerve. This is a DRG, dorsal root ganglion. So you can see that preganglionic neuron come out of the spinal cord through the ventral horn, ventral root, sorry. It comes into the chain, and then it may have several fates. Some of them go upward or downward. Others stop here, make synapse here. Still others may pass through the ganglia and go to the prefrontal ganglia. Okay?
The ascending and the descending fibers not making synapse in this area.
Yeah. So you can see here, it's actually more clear. So the preganglionic neuron starts from the intermediolateral zone, here, the red one. It leaves the spinal cord through the ventral root, then it enters the spinal nerve. Then it exits the spinal nerve through the white ramus. So white ramus means these fibers are myelinated. Right? So preganglionic neuron is myelinated. Right? So it comes into the spinal chain, the vertebral chain, sympathetic chain, right? So some of them synapse here. So let's see what happens here. The postganglionic neuron starts here, come back to the spinal nerve through the gray ramus. So this one is unmyelinated. C-type. Right? So it goes to the internal organ through the spinal nerve. Remember, spinal nerve is somatic. So some of the ANS system fibers actually go through the spinal nerves. Right? Okay. So this is the first phase of these neurons. Some other neurons come to the chain, go upward or downward, and make synapses in other ganglia in the chain. For example, this one. The postganglionic neuron enter the spinal nerve and go to the target, internal. Okay? Some other neurons come to the chain, but there is no synapse here. They go directly out of the chain and they enter the prefrontal ganglia. They will have the synapse in the prefrontal ganglia. From here you have the postganglionic neuron, which is carried through the splanchnic nerve. Okay, splanchnic nerve. So they innervate internal organ. But you can also see some sensory ending here. Sensory ending from the internal organ, go through the splanchnic nerve, they enter the chain, but they don't have synapse here. They pass through the white ramus to the spinal nerve, they go back way, they have their soma in the DRG, then they go through the dorsal root into the spinal.
Sir, the varicosities are present between the peripheral ganglion and the sympathetic chain.
So, the varicosity is for the postganglionic neuron. This one. Okay? So, for example, you can consider this postganglionic neuron which enters the gut, the intestine. In the intestine, it has several varicosities.
Sir, postganglionic neuron starts after the sympathetic chain.
Yes. Inside the sympathetic chain or inside the prefrontal ganglia.
But after synapse, right?
After the synapse.
Splenic nerve is a pre-ganglionic or post-ganglionic?
Actually, splanchnic neuron has both preganglionic neurons and postganglionic. Okay. Other questions? No? Everything is clear, I think? Well, so try to remember the connections, all of the connections. Where the cell body is located, how the axon is carried through the nerves, where they have synapse, okay? Also about the sensory neuron. So the cell body of the sensory neuron is in the DRG. Okay, similar to neurons that bring proprioceptive information, touch information, pressure information. So cell bodies for those neurons are also in the DRG. Okay. So now, sympathetic nerve fibers. Actually, some of the sympathetic nerve fibers are transmitted through spinal nerves I told you, right? These. Okay. So there are postganglionic fibers, there are type C fibers. Through the spinal nerve, they can distribute all over the body. So, for example, sympathetic neurons that innervate the skin are transmitted through spinal nerve, because spinal nerve has a very wide distribution in the body. So they go together with those fibers. Okay? So this is the best way to distribute all over the body. So they control blood vessels, sweat glands, and pyeloerector muscles of the head. About 8% of the fibers in the skeletal nerves are sympathetic fibers. So, preganglionic sympathetic neurons are in the T1 to L2, right? So those located in the T1 generally terminate in the head. So the head area is supported by T1 segment. Right? So, for example, if you have some sympathetic action on the eye, this is controlled by T1 segment. Right? T2 terminate in the neck, T3 through T6 terminate in thorax, T7 through T11 into the abdomen, and T12 through L2 go into the so blood vessels in the leg can be constricted through the sympathetic nervous system. The origin of the fibers in the sympathetic nervous system that do this function are T12 to L2. There is an exception in the sympathetic innervation about the adrenal medulla. So I told you that in the sympathetic nervous system, we have preganglionic neuron in the spinal cord. It enters the chain or peripheral ganglia. Postganglionic neuron starts from the sympathetic chain or peripheral ganglia, right? But here, everything is different. The preganglionic neuron is in the spinal cord, but the postganglionic neuron is not present here. Okay? So preganglionic neuron directly innervates the adrenal medulla. So intermediate natural horn cells, preganglionic. Right? Send the preganglionic sympathetic fiber to the sympathetic chains. There is no stop here. From here they go to the splanchnic nerve. Okay? Through the splanchnic nerve, they enter the adrenal medulla, and they directly activate the cells in the adrenal medulla which release epinephrine and norepinephrine. You can see the figure here. So this is the preganglionic sympathetic axon from the spinal cord, which come directly to the adrenal medulla. It terminates on the cells inside the adrenal medulla which secrete epinephrine and norepinephrine into the blood. Did you have an endocrine system? Yes. So you know that in the adrenal we have cortex, we have medulla. Different type of hormones are secreted by the adrenal medulla, right? Adrenal medulla releases catecholamines, epinephrine, norepinephrine, right? But the cortex of the medulla may release mineralocorticoids or corticosteroids, right? Like aldosterone or cortisol, right? This is from the cortex, but medulla releases epinephrine, norepinephrine into the blood. So there are hormones that are secreted into the blood, okay? But so the cells that secrete epinephrine and norepinephrine receives direct innervation from the preganglionic. They are not through the postganglionic. Okay. So sympathetic nervous system releases norepinephrine. Adrenal medulla also release norepinephrine. So we can say that this gland is part of the sympathetic nervous system. Okay? It's part of the sympathetic nervous.
Sir, is there any difference of neurotransmitter in the pre-ganglionic and post-ganglionic?
Yes, I will talk about this. So now let's see the parasympathetic nervous system. So the origin of the preganglionic neurons in the parasympathetic nervous system is from the brainstem or sacral regions in the spine. So we have some cranial nuclei here, right? So they send parasympathetic information through 4 different nerves. Nerve number 3, oculomotor. Nerve number 7, facial. Nerve number 9, glossopharyngeal. Nerve number 10, vagus. 85% of preganglionic parasympathetic fibers are in the vagus nerve. So when we talk about the parasympathetic nervous system, we mainly refer to the vagus. Okay? So this is very important for us, for physiologists actually. So, but we have S2, S3, and S4 that have some preganglionic neurons that innervate the distal part of the colon, the bladder, the uterus, and the genital epithelium. So here we don't have any chain, sympathetic chain or parasympathetic chain, okay? But we have ganglia. So cranial nerves have these ganglia. Ciliary ganglion for oculomotor, petrigopalatine for facial, submandibular for facial, otic ganglion for glossopharyngeal. But we don't have any special ganglion for vagus.
And sacral also, sir?
This one?
No, sir. For S2, S3, S4, there is no ganglion, sir.
So we don't have also ganglion for these. The preganglionic neuron come to the internal organ. Okay? It activates the postganglionic neuron, which is very small. Okay? And this one innervates the intestine. Usually these ganglia are very small and they are inside the internal organ. So they are in the wall of the intestine.
So, but it is the sympathetic one, above one.
No, these are parasympathetic. So this is the ending of this one. So I cut it here, vagus. Okay? It continues from here.
So for S2, S3, where is the nuclei for this, sir? Like we have cranial nucleus for the above one.
Yeah, we have cranial nuclei for these.
But
Cranial ganglia.
ganglion. But we don't have for
Yeah, for vagus we don't have any
S2,
special.
S3, S4. S2, S3, S4.
Yeah, for S2, S3 and S4 also. Do you have this in anatomy?
There is,
Ganglia?
yes, there is an inferior and or superior ganglion for vagus. But I don't know the place to explain.
Usually the preganglionic neuron from the vagus enter the intestine. Okay? So in the wall of the intestine, they make contact with the postganglionic neuron. So the postganglionic neuron is very small,
Opposite.
right? Okay, so you can see the innervation here. Most of the body is innervated by the vagus nerve. From the organs inside the thorax, heart, organs inside the abdomen, and organs inside the pelvis. Okay?
Sir, for the sympathetic nervous system, the pre-sympathetic fibers come from the lateral one of spinal cord. In this case, from S2 to S4, from which part of spinal cord these nerve rise?
Yeah, I think that they are coming from the gray matter. So because we have the cell body. But I'm not sure if they are coming from the intermediolateral zone or not. Okay.
It is from the lamina 9, S2, S3.
So you can ask this from the neuroanalytic professors. Okay, they do this data. Okay. So let's continue. Let's see the cranial nerves again. So, sorry, you got a question?
No, sir.
Okay. So, I told you that nerve number 3, 7, 9, and 10 actually carry some parasympathetic fibers, right? These fibers originate from some nuclei in the brain stem. These nuclei include Edinger Westphal for nerve number 3, superior salivatory nucleus for nerve number 7, inferior salivatory nucleus for cranial nerve number 9, and dorsal motor nucleus plus nucleus ambiguous for nerve number 10. So parasympathetic fibers in the vagus come from these two nuclei, dorsal motor nucleus of the vague and nucleus ambiguous. Parasympathetic fibers in glossopharyngeal nerve come from inferior salivatory nucleus. Parasympathetic fibers in facial nerve originate from superior salivatory nucleus. And parasympathetic fibers in the oculomotor nerve originates from Edinger Westphal.
Sir, according to anatomy, nucleus ambiguous is a motor nucleus.
Which one?
Nucleus ambiguous.
Nucleus ambiguous.
It is a motor nucleus according to anatomy.
Yeah, so it's a motor nucleus, but it's in the ANS system, autonomic nervous system. So it's the origin of the parasympathetic nervous system. Do you mean it's somatic?
Yes, sir.
No, it's not somatic. Nucleus ambiguous. It's not
These are
somatic.
special nucleus. The nucleus ambiguous, facial, and the facial motor nucleus of the trigeminal, facial, and nucleus ambiguous. These innervate mainly the muscle of head and neck.
Yes.
Those muscles are made.
But muscles of the head and neck are part of the visceral
Viscera,
system.
yes, sir.
So they are not skeletal muscles.
Both voluntary and involuntary.
Sorry?
These muscles are both, in some cases they are voluntary and in some cases they are involuntary.
So they are voluntary. So they have voluntary control, but the origin of these muscles is from the
Brachial muscle.
brachial, branchial muscle. We call this branchial muscle. Which is part of the, let's say, autonomic nervous system. Okay? So let's go on. So again, you can compare somatic nervous system. So the cell body is in the ventral cord. It directly activates the effector organ, skeletal muscle, right? Parasympathetic division is like this. Preganglionic neuron is in the cranial nerve, cranial nuclei, or in the sacral region. The preganglionic neuron is very long. Then we have some nuclei which is very close to the effector organ. So the postganglionic neuron is small. But sympathetic nervous system is like this.
Small.
So we have preganglionic neuron in the spinal cord. They enter some ganglion, then from here we have postganglion. But in relation to the adrenal medulla is like this. Preganglionic neuron directly go into the adrenal medulla. There is no postganglionic neuron here. The cell itself releases the norepinephrine into the blood. Norepinephrine and epinephrine reaches the effector organ through the bloodstream. Right? So now let's see the neurotransmitters. So this is the parasympathetic division, sympathetic division. Right? Both in parasympathetic division and sympathetic division, the preganglionic neuron releases acetylcholine. Okay, so acetylcholine is released in the ganglia of the sympathetic nervous system and parasympathetic nervous system. And the receptor which is involved is nicotine receptor, right? Then postganglionic neurons in the parasympathetic nervous system again releases acetylcholine.
Yes, sir, that
But the receptor here is muscarinic. But the postganglionic neuron in the sympathetic nervous system releases
alpha beta.
norepinephrine, which has alpha or beta receptor. So at 3 of these synapses, we have acetylcholine. In one of them, we have norepinephrine. In the ganglion, we have release of the acetylcholine. The receptor is nicotine. Postganglionic neuron in the parasympathetic nervous system release acetylcholine, which interact with muscarinic receptor. But the postganglionic neuron in the sympathetic nervous system releases norepinephrine, which interacts with alpha or beta receptors. Very easy. Good. But there are some exceptions. And the exceptions make it more difficult. So, okay. This image shows this sympathetic part only. So the exceptions are for the sympathetic nervous system. I told you that all preganglionic neurons release acetylcholine, right? So there are myelinated fibers. Acetylcholine. This one releases acetylcholine plus enkephalin. This one also releases acetylcholine. But the postganglionic neurons in the sympathetic nervous system mainly release norepinephrine. But there are some exceptions. Some of the neurons release norepinephrine plus neuropeptide Y. Neuropeptide Y, which is a neuropeptide, large molecule neurotransmitter, right? So, these type of neurons innervate blood vessels in skin and skeletal muscles. Some other neurons release acetylcholine, okay? Plus, vasoactive intestinal peptide, VIP, you know that. Calcitonin gene-related peptide, CGRP. So, acetylcholine, VIP, CGRP. These postganglionic neurons innervate sweat glands. Another type of sympathetic neurons release acetylcholine plus VIP. They innervate blood vessels of the skeletal muscles. So, sweat glands in the skin are activated or stimulated by the sympathetic nervous system. But the fibers do not release norepinephrine. They release acetylcholine. Okay?
Blood vessel of
Skeletal
skeletal
glands.
blood vessel of skeletal muscle is stimulated by both acetylcholine and
Acetylcholine and norepinephrine. So, some of actually blood vessels in the skeletal muscle receive both of these fibers, norepinephrinergic or cholinergic. But both of them are sympathetic. Okay? So, norepinephrine is released from the varicosities in the postganglionic neuron, in the synapse actually. It can act for a few seconds only. After the few seconds of the action, it is removed. How? About 50 to 80% of the norepinephrine which is released is reuptake back into the axon terminus. Reuptake. Some of them diffuse away from the synapse. And some others are degraded by the monoamine oxidase enzyme. I talked about this yesterday. Remember? And another enzyme is catechol-O-methyl transferase. Catechol-O-methyl transferase, COMT. So, norepinephrine is released. It binds to the receptors, alpha beta. It exerts its action in some seconds. After that, 80% of them is reuptake. Some of them diffuse away from the synapse. Others are degraded or destroyed. By which enzymes? MAO, COMT. Right? Some of the epinephrine and norepinephrine is released into the blood by the adrenal medulla. But they are active for 10 to 30 seconds. So they are active more than this. The norepinephrine released into the blood is more active than the norepinephrine released into the synapse. Right? And their activity is completely removed after one to several minutes. So it's active for 10 to 30 seconds. It's totally removed after 1 or several minutes. So, let's see the receptors. Acetylcholine receptors can be muscarine receptors or nicotine receptors. Okay, so spinal cord, preganglionic neurons in the parasympathetic nervous system, ganglia, postganglionic neuron. So this is not heart. Okay, let's see, like bladder. Okay, so postganglionic neuron, preganglionic. Here it releases acetylcholine. Also here it releases, but acetylcholine released here binds to some receptors which are called nicotine receptors. So the receptor is for acetylcholine, but the name is nicotine. Why? Because nicotine also activates the same receptor. So nicotine in cigarettes, okay, can bind to this receptor and activate the receptor in the same way that the acetylcholine do that. Okay? So we have some other receptors for acetylcholine in the internal organ, which is activated by acetylcholine, but it can be also activated by muscarine. So muscarine is a poison. It can specifically activate this receptor, but this one, muscarine, cannot activate this receptor. Nicotine can activate this one, but cannot activate this one. Acetylcholine activates both. Okay? So this receptor is ion channel. Let's say it's ligand-gated ion channel. So it's ionotropic receptor. But this one is G-protein coupled receptor. It's a metabotropic receptor. Right? So muscarine receptor is G-protein coupled receptor. It found on all effector cells, effector, stimulated by the postganglionic neurons, either in the parasympathetic nervous system or sympathetic nervous system. So I told you, some of the postganglionic neurons in the sympathetic nervous system release acetylcholine instead of norepinephrine. Those acetylcholine also interacts with muscarine receptor, right? So muscarine is a poison from the toadstools. I think it's a type of frog. So nicotine receptor autonomic ganglia, both in the sympathetic nervous system and parasympathetic nervous system. Also in the neuromuscular junction, somatic nervous system, nicotine receptor is involved, right? So nicotine activates only nicotinic receptor. But adrenergic receptors include alpha, beta. Both of them are metabotropic. Both alpha and beta. We have alpha 1, alpha 2, beta 1, beta 2, beta 3 receptors. Nicotine excites mainly alpha receptors. Right? But also activates beta receptors to some extent. But epinephrine excites both type of receptor approximately equally. So imagine that this is the heart. Okay? So a postganglionic neuron comes to the heart and release norepinephrine. In the heart, you may have both alpha neurons, alpha receptors, and beta receptors. Which one is more activated by norepinephrine?
Alpha.
Alphas. So there are beta receptors here, but they are not stimulated that much by norepinephrine. Norepinephrine mainly activate alphas. But there is blood vessel here in the heart. Let's say it's a coronary artery. Inside the vessel we have epinephrine and norepinephrine. So epinephrine activates both alpha and beta receptors to the same extent. And the action of alpha and beta receptors are different. So you can see the action. So alpha receptors mediate vasoconstriction. So when the sympathetic nervous system causes vasoconstriction, it does this through alpha receptors. So alpha receptors on the vessel are activated, they cause constriction. Iris dilation with riahi. The pupil becomes wider. Right? This one is mediated through alpha receptors. Intestinal relaxation, alpha receptors. Intestinal sphincter contraction, alpha receptors. Piloerector contraction. Bladder sphincter contraction. All of them are activated by alpha receptors. Also, neurotransmitter release can be suppressed by alpha receptors, but type 2 receptors. So we call these photoreceptors. So postganglionic neuron release norepinephrine onto target cell. Right? Norepinephrine binds to alpha receptor or beta receptor on the target cell. But there are some alpha receptors here. The same neuron which releases norepinephrine has some alpha 2 receptors. So norepinephrine binds to alpha and beta receptors on the target organ, but also alpha 2 receptors on the preganglionic, on the axotrabeculum. So alpha 2 receptor here suppresses further release of the norepinephrine. So it's like a brake. Norepinephrine is released, it has its action on the postsynaptic cell, but norepinephrine also activates alpha 2 receptors which are presynaptic, right? And this way it suppresses its own secretion, its own release. So we call this autoreceptors. So it's the being on the target cell, it's on the presynaptic cell. Got it? So, let's see the functions of the beta receptors. Yeah, vasodilation happens by beta 2. Got it? Beta 2. So, norepinephrine or epinephrine may cause vasoconstriction or vasodilation, depending on the receptor. If it interacts with alpha receptor, it causes vasoconstriction. If it interacts with beta receptor, it causes vasodilation. So, you can imagine a vessel that receives norepinephrine. The result may be dilation or constriction, depending on the type of the receptor it has. If it has a lot of alpha receptor, it is constriction. If it has a lot of beta receptor, it is dilation.
Sir, these are not parasympathetic functions. These are not parasympathetic functions.
Presynaptic dysfunction?
No, sir. The vasodilation. These are not parasympathetic.
Presympathetic?
Parasympathetic.
Parasympathetic.
This is the sympathetic system.
Constriction. Okay? But parasympathetic doesn't have any effect on the vessels, usually. So blood vessels do not receive a lot of parasympathetic fibers. You can ignore them. It's only a few. Okay, so parasympathetic nervous system doesn't have any action on the vessels. Only sympathetic part has actions on the on the vessels. But it can be constriction or dilation, depending on the receptor. Got it? Okay, so beta 2, beta 1 for cardio acceleration, so heart rate increases by beta 1. Myocardial strength is increased by beta 1. Intestinal relaxation happens by beta 2. So intestinal relaxation also happens by alpha. So both alpha and beta 2 receptors cause relaxation of the intestine. Uterus relaxation, beta 2. Bronchodilation, beta 2. Okay? So the sympathetic nervous system causes dilation of the bronchi. It happens by beta 2 receptors. Cholerigenesis, glycogenolysis, lipolysis, bladder relaxation, thermogenesis. So they are all exerted by beta receptors. You should remember the name of the receptor and the exact name. So you should know if it's beta 1 or beta 2. Okay, so you should memorize all of this. Because you need them. Later in pharmacology, you need them. Okay, so some drugs specifically activate beta 2. Some other drugs specifically activate beta 1. Some other drugs are specifically for beta 3. So all of them are sympathetic drugs, but they have different functions. So when you have a drug which is specifically stimulates beta 2, you can use it for example, asthmatic attack. Okay, you can widen or you can dilate the bronchi. Okay, but for example, you cannot use an alpha receptor agonist for this because alpha receptors doesn't cause actually bronchodilation. Right? So if you need to increase the heart rate, you should have a drug which can specifically activate beta 1 receptor. Right? So, or if you have a drug that has some antagonistic effect on beta 1, the side effect will be low heart rate.